I just performed a surgery on a patient on Thursday, and I said, hey, I bet you had an amazingly easy experience compared to any of your friends. And he says, yeah, I just had a friend of mine whom you rejected as a patient, and he went down to Austin and had a surgery, and he told me it was very difficult and very different experience from what he had. And I asked him this a day afterwards. And so what that brought me up to this concept here in this podcast is that I turn away so many patients coming to me almost every day that want a hair transplant, but I say don't do one. And I say, look, the reason I don't want you to do the transplant, I have a financial incentive, first of all, for me to take you as a patient. But the reason I tell you not to do the transplant, because you're going to have problems down the road that you will not be able to fix. And a lot of 30-year-old men don't care what they look like at 40 because they're single. They want to look as good as possible. Then after they get married, they don't care. But I'm married at 53 and I still care what I look like. And I'll tell you that the problem is when you do a transplant, you burn your bridges. So if the doctor is doing it just for money, or usually it's a business or salesman trying to do this, first of all, they're probably not even qualified to do your work. But in addition to that, they're doing things that I believe are unethical by doing procedures on men that are too young, too far advanced in their baldness, and doing aggressive surgeries that can cause long-term problems. So I'm sad that this patient of mine decided to go somewhere else when I told him, please don't have surgery. So the thing I always tell these young men that come in here is I say, look, please, whatever you do, just don't go down the street and get a second consultation. If I'm telling you no, it's not because I don't like being a surgeon, I don't want to operate. It's because the problem right now is that the entire field of hair restoration is so polluted with people that don't even know what they're doing, big chains that are doing inferior work. Doctors are not even performing the procedure. Doctors are not even meeting with the patient preoperatively. So it's something that I just want to encourage you, is that if you come in and I tell you no, then I really encourage you not to get a second consultation elsewhere. In fact, I had a patient that waited several months to come and see me for consult, and I told him that. He goes, yeah, you have a great reputation of being an ethical doctor, and I'm not going to go anywhere else, so don't worry. But I think it's really important that a no doesn't mean try to go find someone that will give you a